Alice. She has heart palpitations. She is thinking about this danger or doom. She is restless and tense. She has abdominal distress. What do you think Alice suffers from? Is it depression? Is it anxiety? Or is it stress? I'll give you a moment to think about it. Now, some people might say that Alice is depressed. Some might say that she's anxious. Others might say she's stressed. But what medical disorder does Alice suffer from? What is her diagnosis? Good evening, everyone. I am Zeemal from grade Metric, currently studying at GPS. Today, I am here to clear the confusion between a topic which impacts millions of people around the world. The difference between anxiety, depression, and stress. Now, these terms are often used interchangeably, but they represent different and distinct emotional and mental health conditions. Understanding the difference between them can help us be more supportive, mindful, and compassionate towards others and ourselves. Now, before we dive right into our topic, I want to emphasize something. Mental health is not a joke. All of these are real, valid, and serious. Mental health isn't something we can ignore, brush aside, or handle through sheer willpower. It requires support and sometimes professional help. Now, before telling you guys the differences, I would like to tell you guys that what is depression, anxiety, stress. Then we'll move on to the differences, and in the end, I'll tell you the cure for these diseases. Now, moving on to depression. Depressive disorder, also known as depression, is a common mental health disorder. It can happen to anyone. It does not require specific age, specific gender, but it is 50% more likely in women. What? Why? Well, it is because of biological, psychological, and societal factors. Now, according to WHO, depression was recorded in almost 280 million people. This is not a small number. 280 million people is more than the population of Pakistan. Now we know what is depression, right? But how to identify it? Well, depression typically has 9 symptoms, and if you have more than 5 of these for more than 2 weeks, then you are eligible for a diagnosis of depression. Now, what are these symptoms? Number 1, poor concentration. Number 2, feeling of excessive guilt or low self-worth. Number 3, thoughts of dying or suicide. Number 4, disruptive sleep. Now, people with depression usually either sleep too much or they sleep very little. Changes in appetite. You can gain or lose 5 kilos within these 2 weeks. Next, hopelessness about the future. Then, feeling very tired or having low energy all the time. You are not wanting to do anything. You just want to lay on the bed. Angry outburst, irritability, or frustration, even over small matters. And last, loss of interest in things you normally enjoy doing. Now, losing hobbies is common in adults and mostly teenagers. For example, a teenager would leave the hobby of painting and pick up the hobby of poetry. That can be common. But if someone is losing a hobby and not picking up another one, that merits an investigation. Now, what causes depression? Biological diseases usually don't have a singular factor. But according to research, here are some of the main causes which were found in the depression. Number 1, stressful events. Number 2, family history. Yeah, if you have a family history of depression, you are 30% more likely to develop depression. Next, being lonely. Now, how does being lonely cause depression? Well, we all get these thoughts about life, right? We all have these thoughts. But when we have someone we trust, for example, a family member or a friend, we tell them these things. And what do? They help us shut it down. But people with depression, people who get depression don't have someone to talk about. These things to talk about. Like Nida Fazli said, हर तरफ हर जगह बेशुमार आदमी, हर तरफ हर जगह बेशुमार आदमी, फिर भी तन्हाइयों का शिकार आदमी, सुबह शाम बोझ ढोता हुआ, सुबह शाम बोझ ढोता हुआ, अपनी ही लाश का खुद मजार आदमी. So people with depression are usually lonely, and that's why they develop depression. Next, alcohol and drugs. Now, what do alcohol and drugs do? They give us that high feeling, right? That's why many people like to take them. But because they give you that high feeling because of chemical changes in your brain. These chemical changes can in turn lead to depression. Medical disorders. Medical disorders can also cause you depression as you're constantly thinking about those. Medicine? Oh my god, why? This is why people say don't take medicine without a prescription. Yes, do you know there are some anti-allergens which have sleepiness as a side effect? You might know some of them. You might even name them. And there are some medicine which have depression as their side effect. Yes, you can get depression as a side effect. Now to summarize everything I've said, there is a short video which will summarize the whole thing.
Depression is the leading cause of disability in the world. In the United States, close to 10% of adults struggle with depression. But because it's a mental illness, it can be a lot harder to understand than, say, high cholesterol. One major source of confusion is the difference between having depression and just feeling depressed. Almost everyone feels down from time to time. Getting a bad grade, losing a job, having an argument, even a rainy day can bring on feelings of sadness. Sometimes there's no trigger at all. It just pops up out of the blue. Then circumstances change, and those sad feelings disappear. Clinical depression is different. It's a medical disorder, and it won't go away just because you want it to. It lingers for at least 2 consecutive weeks and significantly interferes with one's ability to work, play. Depression can have a lot of different symptoms: a low mood, loss of interest in things you normally enjoy, changes in appetite, feeling worthless or excessively guilty, sleeping either too much or too little, poor concentration, restlessness or slowness, loss of energy, or recurrent thoughts of suicide. If you have at least 5 of those symptoms, according to psychiatric guidelines, you qualify for a diagnosis of depression.
Now, many of you would have thought that this cow is cute, but trust me, you don't want that cow in your life. I hope you guys are clear from depression. Now we will be moving on to anxiety. Anxiety. Anxiety is the persistent feeling of fear and worry. Yes, anxiety is just fear and worry, constantly thinking about things. What if that happens? What if that happens? Anxiety has physical as well as behavioral symptoms. Did you know 4% of the global population suffers from anxiety disorders? Yes. In 2019, WHO had a research which showed that 301 million people across the world have anxiety. That is not a small number. Now keep this in mind when I tell you that anxiety is one of the most common mental health disorders. Keep this in mind and I'll tell you why. Despite having treatment, only 27.6% of the people get the treatment. This is just like 1 in 4 people. Why? Because of lack of awareness. Now, what are the symptoms of anxiety? Number 1, trouble concentrating or making decisions. Number 2, sweating, trembling or shaking. Feeling irritable, tense or restless. Trouble sleeping. Having heart palpitations. Now what is heart palpitations? Your heart shudders, your heart is pacing too fast, or you're missing a beat. Experiencing nausea or abdominal distress. Having a sense of impending danger or two. Now, what causes anxiety? Trauma. Now, for example, let's take an example. There is a person who fell off from a great height. Now, that has set into their subconscious brain. Now, they won't like to go on heights because they'll be like, what if I fall again? That can develop anxiety, brain changes. There is a part of the brain known as amygdala, which is responsible for handling anxiety and fear cues. Research shows that people with anxiety have increased activity of the amygdala because they are responding to those anxiety cues. Genetics. If you have a first degree relation, which is your parent or a sibling, and they are having anxiety, then you are more likely to develop anxiety. And environmental factors. Now, your surroundings play a huge factor in developing mental health disorders. Where you live, where you are hanging out, who are the people you are hanging out, that can play a major role in developing anxiety. Now, I hope you guys are clear from anxiety, so we'll move on to stress. Now, while the slides play, I'm going to tell you what is stress. Stress is the feeling of persistent worry or mental tension. Yeah, many of us are stressed. You will hear many people say, oh my god, I'm so stressed, I have to do this, I have to do that. Many people say this, and that is true. Everyone faces stress to some degree, but how we respond to it plays a huge factor. Did you know that 43% of the population is suffering from stress? That is almost half the population of the world. And 75% to 90% of doctors' office visits are due to stress and stress-related problems. Now, what causes stress? The causes of stress can include financial problems. Obviously, if you have a family to feed, you're going to be constantly thinking about the money. If you don't have money, then you're constantly going to be stressed. It can include chronic conditions. If you have a condition which does not have a treatment, then you can continuously think about it, which will cause you to develop stress. Then we are having job or work situationships. For example, you have a job interview, or you have something at work, you have promotion at work, then you're constantly going to be stressed about it. Or you have faced a trauma that can sit into your subconscious brain, then you will face stress. Then we are having change. Now, adapting to change can be scary and it can be stressful for everyone. That can help you develop stress. Then big projects such as organizing a wedding, building a house, that can also make you cause stress. What are the symptoms of stress? Symptoms of stress include exhaustion, headaches, aches or pain, high blood pressure, digestive problems, muscle tension, panic attacks, worrying or irritability. Now, we know what is stress too, but how are they different? Well, depression is usually more about the past or the present. It is more about what's happening and what's not happening. It gives you that feeling of loss, worthlessness and hopelessness. It is having the symptoms of you leave your hobbies, you are not getting enough sleep, your appetite changes, etc. Now, depression comes with a feeling of numbness and heaviness, which stress and anxiety do not. How anxiety is different? Well, anxiety is usually about future oriented. I can describe anxiety in just 3 words. What if emotion. It is a what if emotion. You are like, what if I do that and that happens? What if I do that and I make a fool of myself? This is usually what happens in anxiety. Now, anxiety usually also comes with physical symptoms, which could be your heart is pacing too much, you are shaking, you are trembling, you are feeling restless, you are feeling irritated. people. How is stress different from all of these? Well, stress you can usually point out to an specific external trigger. Unlike anxiety is just like generalized. You can have a general anxiety disorder, which is GAD, which is across multiple life aspects. Or you can have social anxiety, which is when you see too many faces and then you get anxious. Or you can have phobia. Yes, I'm pretty sure you have heard of that word, phobia. It's when you are scared of something or of a situation, then you can develop phobia, and it is a part of anxiety. And stress is something like you can point it out. You could be like, oh my god, I'm stressed because of my job, I'm stressed because I have to do that. This is where chronic stress comes in. Chronic stress is when you don't have a chance to recover. For example, you moved into a new neighborhood and then you're stressed if you will fit in or not. Then you are completely stressed about it, and then when you're going to settle down, then you became a parent, for example. If when you became a parent, you're constantly thinking, will my child settle in over here? Will he be okay? Will he be fine? Etc. etc. So you can point it out. Stress also sometimes comes with symptoms that could be exhaustion or headaches, and it is usually different from anxiety and depression. Now, since I told you guys they are different, they can also all occur at the same time. Yes, that is right, they can overlap. Maybe you are stressed about work, anxious about an uncertain future, or depressed because you are hopeless about your ability to cope. The lines can all blur, and this is why it is crucial to seek professional help when the lines get blurry. Now, do you guys remember I told you to focus that anxiety is one of the most common mental disorders of all time? Well, here I have a research study. This was done in Malaysia on some university students, where it was proved that anxiety is more common than depression and stress. Now we know what each of these are. Now let's move on to how to cure them. Yes, curing them plays an important role too, because once we know that we are suffering from this depression, from these diseases, we need to take an immediate step. Did you know only 40 to 50% of people suffering with mental disorders get treatment? Now, what are the solutions for depression? Try to keep doing things you used to enjoy. Stay connected to friends and family. Exercise regularly, even if it's just a short walk. Stick to regular eating and sleeping habits. Avoid alcohol and drugs. Talk to someone you trust about your feelings. Seek help from a healthcare provider. Now, psychological treatments of depression. There are some psychological treatments of depression too. And the reason I'm not mentioning antidepressants over here is because I'm not a licensed medical professional. So I can't tell you any medicine without gathering the info, which is why you need to go to a professional medical licensed person. So, behavioral activation. Over here, in this therapy, they usually try to influence you by showing you their behavior or someone else's behavior. CBT, cognitive behavioral therapy, is where they make your behavior different by role play. Interpersonal therapy. Over here, you talk about your friends, your family, your relations, etc. Problem solving therapy. Here, they give you life situations which would usually make you stressed or nervous so that you are prepared for them. Now, what are the solutions for anxiety? Soothing or relaxing activities such as a massage, a bath, etc. Getting adequate sleep or as much as possible. This does not mean that you leave everything and go to bed. No. You should get the normal amount, which is like 6 to 8 hours. Making time for things you like to do. Journaling. This is so important. You need a place to put your thoughts so they don't come again and again. And then when you put those thoughts on paper and read them again, you will see just how crazy your thoughts are. Feel okay saying no. Now we are having 10 solutions for stress. Be active, take control, connect with people, have some me time, challenge yourself, avoid unhealthy habits, help other people, work smart, not hard, try to be positive, and 10, accept the things you can't change. Now you can't bring Jupiter in front of Mars, can you? No, you can't. So accept it. You can't change it. Now, In closing, I want to emphasize something. Reducing stigma. Mental health is not a sign of failure or weakness. It does not make you weak. And understanding this can help us seek help and heal. For those people who are suffering from depression, anxiety, and stress and are having suicidal thoughts, I want to say this poem. No one ever looks at the stars and wishes they were gone. No one ever asks the ocean why it stayed so long. No one wishes the moon away. They don't ask for it to disappear. No one is unkind to the sun. We know it is needed here. No one questions the existence of these things because we accept they are exactly where they are meant to be. So don't you dare look in the mirror and wish yourself gone. Don't ask yourself why you stayed so long. Don't ask to disappear. Don't wish yourself away. Don't be unkind to yourself. Please know you're needed here. Please accept you are exactly where you are meant to be. Please do not question your existence. Thank you.